White Plains, we set out a very ambitious plan to get all of our personnel, over 1,200 of them, who were willing and able, appointments to be vaccinated. I threw a number out there, like we'd love for 70 or 80% of those people to be able to help them get those appointments and get in process. Some folks were like, yeah, you're never going to get that. And you know, that wasn't unfair of them to say. It's a high percentage. Well, last Friday, thanks to Kara and David, and thanks to Adele, and thanks to Jennifer, and everybody who has pulled together and worked as a community here, we were able to overcome that 100% mark of offering vaccine to everybody in our district who told us they needed an appointment. That is huge. In partnership with the County of Westchester Department of Health, with NICET, with CSEA and ASA, to be able to have offered that to everybody who was willing was huge. So just a round of applause to all of you folks who made that happen. I can't say enough. George Latimer, Joe Glazier, Joe McDonald, Dr. Amler, all of the folks who have been working to support our school districts in Westchester County are to be commended. The vaccines are still being distributed to school districts throughout the county. That's good news for everybody. Some school districts, I'm going second, I'm going third, I'm going fourth. It doesn't matter when you go. The more people in our community who are given the opportunity to be vaccinated, the stronger and safer it makes all of us. So this is really positive news for Westchester County. Our numbers are on the decline in Westchester County. Our hospitalizations are on the decline. We're moving in the direction we want to move. It's going to be 60 degrees next week. I might as well throw a cherry on top of that, right? So it's nice news. Now, New York State Department of Health has indicated that they are going to follow the CDC guidelines, which we have been following, and that they're going to make some clarifying points to the state in the coming days and weeks, I suppose. One of those clarifying points is related to quarantine for vaccinated individuals. The other is the so-called conversation, the push and the pull between 3 feet and 6 feet. 3 feet and 6 feet. We need the state of New York to tell us we can go below 6 feet. They already did. We already have that flexibility, and we already have that ability in the guidelines. So White Plains is obviously aware of that. Westchester County is aware of that. Unfortunately, in some other parts of the state, we're still trying to get that word out, so people understand that it's not an all or nothing, zero-sum conversation, as long as you are layering on the mitigating factors and mitigating strategies if you're going to go below 6 feet. So in White Plains, we know that in many instances, not all, but in many instances, our children, in order to be back in school full-time, all kids, are going to have to be below 6 foot of physical distance. In some of our classrooms, I have to tell you, we're as you know, pretty close, depending upon the number of students in a class and depending upon the layout of the classroom. What we're endeavoring to do all throughout the district right now is to make sure that we are situating our facilities so that children are as far away as possible, but at the same time allowing for 100% of our children to return to school. The layered mitigation is everything in this conversation. The first layer, by the way, is vaccine. But the kids aren't vaccinated. That's true. The kids aren't vaccinated, and I'll talk about that in a minute. But for our faculty and staff members, what'd you do? Mute me, Mr.?
Did Dr. Ricca? I was trying to get Lola in. I apologize.
That's okay. To get that layer of mitigation in there, that was our ground floor. We agreed. So this entire time, we've always prided ourselves on trying to be thoughtful, as smart, as intelligent as we can be in making decisions, conservative where it made sense when we didn't know answers, and we want to continue down that same pathway, and that's why we knew that vaccination was going to be our first foundational point. The next foundational point, of course, is making sure that we have the barriers in place in all of our learning spaces, so that there is this impediment to any particulates in the air that could be potentially spread, including virus particles. Of course, our children and all of our adults are also going to be continuing to wear facial coverings. Some will double up, and they'll wear two, and that's great. Some will also wear face shields, and that's great too. By the way, all those will be available to any employees who are interested in that. Teachers will also have their barriers, and support staff will also have their barriers in place. And this is going to go throughout the entire school district. All of the other safe mitigating factors that we're still doing, daily health screeners, making sure we're staying home when we're sick, not putting our hands in our mouth, all those good things are still in place as well. Okay, so this is the layering of the mitigation. But what about air ventilation? I'm glad you asked. We, as you know, took the steps to go through all of our unit ventilators at the beginning of the academic year and make sure that they were all up to code. We replaced all of our filters and made sure we had the appropriate MERV filters in there. So all of our air handlers are changing the air in the room with fresh air on a regular basis all throughout the day. So you have that circulation going on. And I know people have been seeing these infographics. The New York Times is posting a lot of them. You have to be really careful when you're looking at these infographics on how air circulation goes. You'll notice in some of those, there are no unit ventilators in the classrooms. So absent an open window, you're not getting airflow, fresh airflow. Well, can we open windows in White Plains? Absolutely. And I know many of our colleagues do every day. Well, what could we add more to that mitigation? Could we add more air purification in the classrooms? Yes, and we're going to do that too. And that's on top of the mitigating factors that are in. Those air purification systems will be coming in over the course of the spring, and we'll be installing them. They're not a delimiting factor of us being able to phase back in. They're an added support, similar to tenting. We talked about tents, and yes, we're ordering tents for all